Good evening. I'm Dr. Yatin Joag. I'm a practicing physician in Solapur since last 35 years, and we have been going on with the epidemic of renal problems, which is associated with diabetes. As you all know, India is a capital of diabetes, and one of the dreaded complications of diabetes is chronic kidney disease. Now, what is chronic kidney disease? See, everybody, we have to monitor glomerular filtration rate in every patient. What are there are some stages of glomerular filtration rates which are important. One is the glomerular filtration rate between 60 to 90 or higher is said to be stage one or almost normal kidney functions. The patients in stage two kidney disease, the GFR is between 60 and 90. In CAD stage three, the kidney function starts deteriorating. It is between 45 to 59. At this time, the patient starts feeling the symptoms usually, and they present to the doctor. Usually, when patients come to us for the first time, normally they are on anti-diabetic medications and taking those oral drugs for a long time. There are some drugs which are also harming the kidney, and they are continuing with that. Next, when the stage four kidney disease, when the GFR goes between 30 and 45, which needs intervention and starting of the management. Yes, in stage four kidney disease, patients need active management either with dialysis or medications plus dialysis and some other drugs. The GFR in stage four is between 15 and 29. And last stage or terminal renal failure is if the GFR is below 15. Now, what are the common symptoms which we present with? Normally, diabetic patients present first time with swelling, fatigue, apathy, not to do anything, shortness of breath. They also may have additional elevated creatinine, blood pressure, and they present with nausea, vomiting, loss of appetite, and muscle cramps or itching of the skin. The skin is very, very dry. All these patients indicate to progression of diabetes to chronic kidney disease. This needs evaluation and management. Usually, if detected in first or second stage, the chronic kidney disease can be stabilized with lot many drugs nowadays. If they have severe anemia, that should be corrected. If they have shortness of breath and hypertension, that needs to be corrected with antihypertensives or SOS with diuretics. Loss of appetite is a part and parcel if the creatinine is very high, and that should be tackled with creatinine. If anemia is severe, you should start with erythropoietin at an earlier date. Now, what we normally do is patients are asymptomatic, they don't come to doctor. When they come to the doctor, they already have a fairly advanced second stage or third stage renal failure, and that needs evaluation. What we do in all these cases is evaluate the kidney, evaluate his blood pressure, do ultrasound and see for the kidney size. And what is most important in every diabetic patient when we treat them, we always evaluate for kidney status every 6 months, or if they come normal, at least once in a year. Then this can lead to serious complications, including cardiovascular diseases, anemia, bone problem, mineral disorders. And what do we do to monitor? Regularly check the eGFR for every patient in diabetes at least 6 months, once in 6 months. Regular monitor glucose levels, try to keep the levels in appropriate with management of drugs. New drugs like SGLT2 inhibitors, they can be done. DPP-4 inhibitors, particularly linagliptin, is a drug of choice if the patient has slight renal impairment also. Then we have to see for anemia and electrolyte imbalance. Iron supplementation should be given, or erythropoietin should be started at a very early day so that it definitely reduces the progression. Then there is renal osteodystrophy, which is a complication of renal failure, which leads to vitamin D3 deficiency, bone pain, and the lifestyle changes are encouraged, like regular exercise, cessation of smoking, proper control of diet with proper dietary advice and monitoring, patients education to provide information about CKD and management and care. This, if taken properly, many patients do not go for dialysis or transplant. And if the stages are advanced, then you can go for dialysis or management with kidney transplant in terminal renal stages. These are according to the KDIG guidelines. If the eGFR is below 15, albuminuria persistent, then CKD is diagnosed. And in high-risk patients, parameters, they can usually undergo kidney transplant at an earlier date, but that gives excellent results and patient can survive for a long time. Early detection is the most important part. So every diabetic patient or every patient who has suspicion of kidney disease should be evaluated properly. Elevated blood pressure, persistent hypertension, persistent anemia which is not responding to routine treatment should be catered, and we can treat kidney disease and stop the progression. Diuretics is one stay, but they should be used with caution in every patient. Thank you.